during COVID, you need a doctor's note to go back to work or school, or and the push was to avoid going to the ED, the ER, right? Emergency Department Diversion. So it's many health systems are pursuing digital care innovation, and they describe the ED diversion rate as their ultimate metric. Since up to 8% of virtual encounters currently result in patients avoiding the ER, which in Pediatric Associates case represents literally thousands of patients a year. What specific protocols or priority tags do your telehealth coordinators use to identify high-risk patients before they decide to leave the queue for the hospital?
Yeah, ER diversion is definitely our number one focal point that we use here at Enterprise Telehealth to really not only kind of focus our care into like a North Star, but also to really measure the impact that we'll have, not just again on our patients' lives, but on our payers' relationships, our contracts, everything from capitation agreements, MLR, all that type of stuff that a lot of healthcare execs are probably looking at. So the queuing that we use in KidzDocNow is actually sort of like the second or third step downstream in a process that sometimes begins with an interaction on our phone system through our organization, or maybe an encounter at an office, or maybe a message we receive for our patient portal. So we do skim at various points and try to contain costs as much as possible. Again, whether it's giving home care advice through a medical assistant or a registered nurse through our clinical advice line, or if it is, again, through a on-demand visit through KidzDocNow, where a patient will initiate care by joining our app, joining our virtual waiting room, and then being processed by a telehealth coordinator, as Jeff you kind of outlined in the last bit of this question here. So we have available to our telehealth coordinators a list of symptoms or concerns that if they're in receipt of from a patient during the screening process, that they will immediately isolate that patient, flip them into what we would call a high priority status, in which all of our clinicians are trained as they are scanning our virtual waiting rooms to immediately grab that patient if someone is available. It leapfrogs every other patient that is waiting at that moment in time, so that we can obviously make a decision of whether or not this child's care is appropriate on telemedicine, or if they need to be handed off to a higher cost option, such as an urgent care or an emergency room. And something we had talked about at length, Jeff, and not just today, but previously, we sort of bundle in emergency rooms, urgent cares, all sort of into one bucket of just a higher cost center that would obviously punish us on our capitation agreements, on our VBC models, and really not deliver any real quality improvement as far as care delivery to a patient. I think we've all heard of stories of people taking their child to the ER and they just basically get examined to ensure that they're not experiencing something life-threatening. And then they can sort of just be handed back to their PCP the next day that they're open for business. And that's not good healthcare, right? Like it's great ambulatory medicine. It's great, obviously protection of life, but it's not healthcare. It's sort of delayed care, if you will. So really one of the things that we've been trying to teach our patients over the years, and I think it's really helped us grow our practice, is just sort of the 24/7, 365 operating model that we have employed as an organization, where we answer our own phones 24 hours a day. We operate KidzDocNow on demand 24 hours a day. And we suggest that our patients contact us first so that we can help them get timely care by the right folks, basically whatever fits into their life at the time. There's the times where parents are not able to get to the office, where it's 3 a.m. in the morning and everything is closed, but us, we're open. And we can often help patch together a telehealth visit and a visit that needs to be completed at a brick and mortar because perhaps labs are required or an actual physical exam is required that we don't have the technology to complete on KidzDocNow. So we are, again, as I kind of described, part of a process as Enterprise Telehealth, where sometimes the visit is contained and stopped with us. Sometimes it's contained before it hits us by, again, a medical assistant using our scripted screening protocols, or a registered nurse doing true triage. Or sometimes we are appropriately referring the patient to a higher cost option when their symptomology and their perhaps history warrant that. Making really, again, the ultimate sort of value-based care powerhouse that we are not just only scaling in Florida, but we are working to evolve our contracts across our organization to all be value-based care. Because really, again, that makes us, I think, really strong stewards in the entire healthcare space, not just as individuals, but as an organization. We're thinking of cost and quality in perfect sync.